Hello, my lovely viewers and my hard-working colleague nurses. I come your way again with a little chat. Today we are going to talk about the nurse as an advocate, and we are flying all the way to Africa, where I originally trained, specifically in Ghana, a little over 20 years ago. So you can just imagine how happy I am to talk to my fellow nurses in Ghana and in Africa as a whole. The nurse as an advocate. The fundamental of nursing is universal, it's international. It's, its principle is the same wherever you are. Yes, there are some cultural differences, which kind of bring some form of variation when we are dealing with our patients. But we must not lose the fact that the principle is the same. I mean, as soon as the patient comes to your care, the patient is yours. You are responsible for the patient. In Ghana, for instance, we do have relatives coming in to see patients at certain times of the days, and when they do come in, they do assist with personal hygiene stuff. Under normal circumstances, it is not their responsibility. But take into consideration things like shortage of staff, and probably they might not leave the things that you actually need to take care of this patient. So they do chip in, which is something we are all grateful for. But we must not lose the fact that as they do perform these activities in taking care of the patient, you, the nurse, has to be vigilant. You have to be vigilant. This is much more common in less controlled treatment areas like the wards. You have to be vigilant. I'm saying this because not every relative is comfortable with their relatives, if you do understand what I'm trying to drive at. We may be siblings, but I may not be happy with everything that you think I need. So this is where you, the nurse, steps in. It's your responsibility to educate both the patient and the relatives what is actually needed. So we must not throw what we are taught in the colleges and the universities away. In most cases, we learn these things. As soon as we get to the ward, it all vanishes. We learn the old ways. Meanwhile, there are policies, there are researches coming out every time. So it's you, your responsibility as a nurse and the patient advocate to get yourself updated. Let's take, for instance, a patient is being fed by a relative and the patient is uncomfortable. You don't have to close your eyes to the situation. Step in, find out what is going on. In a calm way, reassure the patient, and then, if necessary, talk to the relative what is needed. In most cases, we lose the fact that these things need to be done and it's our responsibility. Never take sides with a relative coming from outside. There have been situations when people feel, oh, they are from the same household. Probably she has an attitude. The patient may have an attitude, but at that very moment, the patient is in your care. So you do what is necessary for the patient to get better. You don't take sides. So you, as the advocate, must make sure the patient receives the right care and treatment. You are an advocate even when the doctor comes in to see the patient. If you are engaging with your patient, you do know that the patient needs certain things and they may not be aware of. So it is your responsibility to mention these things to the doctor. Nobody wants to go into hospital and then go home sadder or sicker. And no one wants to come into hospital and stay longer than necessary. We all know the cost that comes with these days in hospital. So please, please, I may be offending some, but trust me, it is the truth. Let's take our responsibilities seriously. So, the nurse, as an advocate, please take up your advocacy role. Thank you. I will come again your way. So please stay tuned. Remember to subscribe, share, and comment. Thank you. And this is me, Janet, signing off. Bye-bye.